Good afternoon and welcome back. My name is Robert Resendiz. I'm the director of the City of El Paso Health Department, RES-END-ES. I know you've been here a couple times in the last week. We're glad to have you back, and we appreciate your help in getting our message across to the people of El Paso. I'll be making a few remarks, and I want to introduce our panel and special guest today. To my immediate right, Dr. Enrique Martinez. He's the medical director at Providence Memorial Hospital. To his right, Dr. Hector Ocaranza. He is our medical director in the health authority for the city of El Paso. To his right, our mayor, Mayor Leeser. And then next to him, our city manager, Tommy Gonzalez, Representative Lily Limon, and the CEO of Providence Memorial Hospital, Eric Evans. Thank you. I'd like to start off by saying this has been a hectic week for the community and for our staff. Every day this week, I've been out front in our clinics, meeting parents, grandparents, even great-grandparents, as they bring their children in to be tested. When they're finished, I'm meeting with them as well, making sure that their questions are answered and that their needs are met. And I would like to report that so far we've had a really good first week. We've seen over 200 clients, patients, and they are having good experience while they're here, and we hope to keep that up and improve upon what we've been doing. I want to reinforce that our community is safe. Tuberculosis has been in our community since we've had a community. It's an old disease. It's been around for thousands of years. This is nothing new. It just may be a little larger than we're used to dealing with, but it's something we know how to deal with. In this past week, I'd also like to tell you that we've fielded over 2,000 phone calls through our 211 system, our international toll-free number, and through a local El Paso exchange. I'd like to report to you, as we have promised with regular updates, that we have had direct contact with 534 of the 759 listed patients, either by mail or phone, and our health partners in other countries and states are helping with this outreach. So by our calculations, we've reached out and have had contact with 70% of the people that we mailed in 1 week. In an epidemiological standpoint, that's a really good high number. Of those on our evolving list, we've had contact with 449 of the 622 that reported living in El Paso. That's a 72% rate. Of those living outside of El Paso, we have been able to make contact with 88, or 60%. That number is probably higher, but the reports we're getting from Arizona, New Mexico, and Mexico are a little bit delayed. Over 500 appointments have been scheduled. And to date, just over 200 screenings have been completed in our first week. We are fully booked for next week, 360 appointments. What we did this past week, we started with 40 appointments on Monday, so we get a feel of how this was going to work. It went well. We doubled our production. We saw 80 patients, scheduled 80 patients on Tuesday. That went well, and our staff said they were up to the challenge. So we triple booked on Wednesday, and we saw over 100 patients. We were booked 6 weeks out when we first began this because we thought 40 to 80 patients was the most we could do. So we have called those patients that were out in week 6, week 5. Everybody's been moved into week 2 and 3. Remind people that a visit of this type is kind of a 3-part visit. We have the babies coming in and they're being injected with a skin test. And then they're expected to get a chest x-ray, and then they have to come back to get their skin test read, chest x-ray reviewed. So it really is a 3-part visit. And in 1 week, over 200 families did that. So I take my hat off to them. Today we are announcing that 5 infants have tested positive for TB infection. However, 4 of those were vaccinated with BCG. That's a vaccination against tuberculosis that's used in other countries. So there's a good possibility that because they had that vaccination, their tests are false positives. But we will offer treatment to them anyway. That leaves us with 1 case that did not receive the BCG, a 7-month-old who did test positive, and we're following up with a family and offering treatment as well. So for those 200, the 1 sure case, we're looking at a 0.5% infection rate so far. I'd like to say, because you're here today, we're going to reopen our 211 lines. We usually closed over the weekend. We weren't last weekend. And anticipating you're going to do a good job, we're going to have our 211 and our local line open from 6 to 11 today and 8 to 5 tomorrow to schedule appointments if there's any left, and to answer any questions people may have. I want to repeat, the thing we saw the most with families coming in, the moms that I talked to, is concern for other family members and siblings. We've said this over and over again, but it doesn't get old, and we can say it more. And that's that these babies who've been exposed are not infectious. They cannot spread that disease to anyone else, not to siblings, not to moms. Tomorrow, our CDC team arrives, and the Department of State Health Services is sending helpers as well to assist in our investigation. I want to be clear that we asked for their help over a week ago. It's a coincidence that they're arriving tomorrow and we're having this press conference today. They're not here as a result of positives, which we anticipated would probably get some, and they're starting to roll in. We have identified an additional 96 babies who are potentially exposed. Letters are going out to those families on Monday morning, and that'll bring our grand total around 858. Again, those numbers fluctuate a little bit. We've had some people who were on the list twice. We had a mom with twins, so that was a double count, or so we're working on that. And we expect these numbers to fluctuate as they always do in incidents like this. So with that, I'm going to introduce again Dr. Enrique Martinez, Medical Director of Providence Memorial Hospital, who has some updates for us.
Thank you, Robert. Good afternoon. My name is Enrique Martinez, and I'm the Chief Medical Officer for the Providence Memorial Hospital. We were notified by the Health Department that 5 individuals have tested positive for latent tuberculosis, or as the industry calls it, TB infection, which indicates past exposure to the germ that causes tuberculosis. 4 of these 5 babies previously received the BCG vaccine, which can cause a false positive test result. These individuals do not have active tuberculosis. They are not sick. They are not contagious. And we are offering them prophylactic medication that are highly effective in preventing the development of active tuberculosis. Providence Memorial Hospital continues to work closely with the El Paso Department of Public Health and the Texas Department of State Health Services as they work to identify, contact, and test individuals who may have been exposed to TB at our hospital. We will continue to provide all information requested and to support the testing program by providing personnel for the testing center and free chest x-rays to individuals being tested, and by covering costs incurred by the city for the testing program. We also welcome the input of the Center for Disease Control and Prevention, which will arrive Monday to provide additional input on the testing program. Thank you.
Thank you again for coming. I'm Dr. Hector Ocaranza. I'm the health authority for the city. A little bit more information as far as the screening process. I'm sure a lot of the parents that have come already to do the screening process have seen how smoothly it flows. I know that we asked the parents and we urge the parents to come forward, call 211. If you receive your letter and you haven't done your appointment, please do so. We would like to check your kids, make sure that they're going to be fine, and we want to see everybody healthy in this community. As far as the screening process is pertaining, we're going to be doing several steps, as Mr. Resendez has said. First, we put the tuberculin skin test, which is a very simple skin test in the inner part of the arm, and also we send them for a chest x-ray. With those 2 parts, we initiate the screening process. 2 days later, we need to read the tuberculin skin test, and also by that time, we should have a reading on the chest x-ray. All the infants that are younger than 6 months, we're offering prophylactic antibiotic. This prophylactic antibiotic, also known as window prophylaxis, is proven to be effective as preventing the latent TB that later on can translate into active TB. But since we don't know when the process from latent TB to active TB happens, we would like to offer this, and it's based on the recommendations from the Centers for Disease Control and all the experts on tuberculosis. We would like to continue this screening process as recommended by the experts, and we want to make sure that the parents are comfortable with the process. The medication has been used for a long time. I know there's been concerns as far as the medication, but we want to assure the parents that we want their infants to be healthy. That's why it's our utmost priority to make sure that our infants in our community, even though they were exposed, they will continue being healthy. So again, to the parents, there's quite a bit of information out there. We would like to set their minds at peace that the medication is safe for their babies, and it's an extra protection that it's been offered for them. So thank you very much, and now I'm gonna introduce Mr. Martinez to come and. I'm sorry, Gonzalez.
Thought he demoted the doctor. Well, I'm here because I want to ensure the public and reinforce to the public that everyone is working together for the safety of the families and of this community. And all those folks that are working together includes our health department, the Centers for Disease Control, as well as the New Mexico and Mexico officials and the state officials here in Texas. We want to give our thanks to all those different groups that are working together. But the mayor and I are here in order to show that we're acting swiftly and responsibly, and that all the proper agencies, not only within the city, but with the state and national organizations, are working assiduously to really address all the issues regarding this particular situation. We've worked really well with the hospital. I want to thank them for their cooperation, and I'll turn it over now to the mayor, ask him to say a few words.
I just want to make sure that if you received the letter, please contact 211, the health department, and make an appointment. It's very important that we get the children screened and make sure that everyone comes forward. And also that we continue, that anytime we have any information, the health department, the city, Providence, my office, that we will continue to come forward with all the information as we have today. And the most important part to the city is to make sure that all the public continues to be healthy. And that is the #1 priority of ours today. And so we do have a press conference today because we do have information, and it's important, like we have, to continue to bring it forward as soon as we get it. Mr. Resendez?
Thank you, Mayor. Okay, at this point, we'll open up for questions now. Yes, sir.
Alejandro Saldívar, la base en español es para Univisión, es para el doctor responsable del Hospital Providencia. Doctor, ¿cómo es posible que pase un problema así de esta magnitud en el hospital? ¿Y quién es el responsable que haya pasado esto?
Bueno, en nuestro país, en nuestro estado, en nuestra ciudad, hay gente con tuberculosis. Pacientes con tuberculosis vienen a los hospitales seguido. Todos los hospitales tienen pacientes con tuberculosis.
Se habla de un empleado.
Desafortunadamente, a veces los empleados se contagian con el tuberculosis, principalmente porque los pacientes se presentan y tenemos ese riesgo como empleados de salud. En términos de la presentación de tuberculosis, es una presentación a veces confusa. A veces el paciente no sabe si en realidad está enfermo o no está enfermo. A veces los doctores que cuidan al paciente, en este caso el empleado, pues no hacen el diagnóstico rápidamente, así que ni el paciente ni el doctor saben lo que tiene el paciente. Por lo tanto, el paciente, aunque trabaje en el hospital o trabaje en cualquier otro trabajo, sigue trabajando porque ninguno de los dos sabe que tiene esa enfermedad. Así que a veces esa tardanza en diagnóstico causa que estos pacientes expongan al público a esta enfermedad. Pero esto desafortunadamente ocurre en todo el país porque se tarda a veces en diagnosticar al paciente. Así que es algo que contribuye a que hasta ahora la tuberculosis sigue presente, no se ha eliminado, y es que es difícil esta enfermedad.
Nada más para entenderlo bien, doctor. Entonces me está diciendo que esto fue a causa de un paciente que estuvo expuesto a un empleado del hospital y de esta manera fue como se propagó.
No, yo no dije eso. Yo dije que a veces hay pacientes que vienen al hospital y pueden exponer a empleados, pero no sabemos por qué el empleado tiene tuberculosis.
Ok, no lo sabe entonces.
No.
¿Está preparado para una demanda? Nosotros hemos entrevistado a personas que nos han dicho que si resultaban positivos iban a demandar al hospital.
Esa es una pregunta que se contestará cuando ocurra.
Zach Brown, News Channel 9. Are more medical staff going to be brought in to deal with the increase in the total number of possibly exposed children?
Yeah, I'll take that. Our staffing currently is a mix between the health department staff and hospital staff. Hospital's been very generous in loaning us some wonderful nurses, and we've had a very quick, wonderful working relationship. For these extra, I think it was 87, 90 kids that were identified, we could probably absorb that with the existing staff. Thank you.
One more question. You know, how could they test positive but don't have active TB and such? I know you guys were mentioning that, but just a little more clarification.
No, and actually, it's a great question. Basically, because it's a little bit difficult to understand. If the people receive the vaccine called the BCG vaccine, that, as Mr. Resendez mentioned, it is given and offered in other countries and not in the U.S. The skin test that we use, it uses the body's immune response or their own defenses to detect these specific bacteria. But the bacteria, there's different kinds of bacteria. The one that they use on the vaccine is attenuated, meaning that it's weakened and it's not the active tuberculosis bacteria. We provide this vaccine in other countries to protect against other disseminated tuberculosis diseases. But unfortunately, when you use the skin testing, it is positive, and meaning that the body immune system is healthy and reacting against this bacteria.
La vacuna de tuberculosis se lleva a cabo en la ciudad de Ciudad Juárez. Quería saber si esperan que esos números incrementen positivos de gente que tenga tuberculosis de Ciudad Juárez cuando reciban los números.
Claro que sí. Si estas gentes recibieron la vacuna de la BCG, cuando vengan a hacerse la prueba que les hacemos aquí de la piel, van a salir positivos. Y esos números son los que estamos esperando que puedan salir positivos también. Estamos hablando con las gentes cuando vienen también a sus citas con respecto a eso. E inclusive cuando hablan por teléfono, si preguntan, mucha gente va a preguntarme, ¿tengo que poner la vacuna de la tuberculosis? Porque sabemos que en México la ofrecen. Realmente, si vamos a hacer estas pruebas aquí, recomendamos que no se ponga la vacuna para tener una idea un poquito más clara de la situación del bebé y qué es lo que está pasando.
¿Cuándo esperan ver los números de Ciudad Juárez?
Conforme vayan haciendo sus citas, por eso les suplicamos y les decimos y exhortamos a todas esas personas que recibieron su carta que hablen al 211 y que hagan su cita para que vengan a revisar a sus bebés.
Se nos ha informado que muchas de estas citas, los números de contacto ya no son vigentes. ¿Cómo planean contactar a esa gente que los números ya no son vigentes?
Tenemos agencias en Ciudad Juárez que también nos están ayudando al mismo tiempo que las agencias en Nuevo México y en otro estado para poder contactar a la mayoría y esperamos contactar a todos esos bebés que viven en el exterior, en Ciudad Juárez, Chihuahua o en otras partes de México.
¿A qué se debe el aumento de la cifra de los niños que están en peligro? O sea, ¿cambian las fechas de infección o cómo pasa que ahorita tenemos ya más de 90?
No cambian las fechas de infección, sino que simplemente se expandió un poquito más para poder proveer un amplio margen de precaución, más que nada.
Tal vez una última pregunta para el doctor del Providencia, doctor. Se había hablado de no sé si han recibido alguna notificación de parte del gobierno sobre posible retiro de fondos federales hasta ahorita.
Pues tenemos una visita de lo que le llaman el Centers for Medicare, Medicaid, CMS, que ellos van a visitar el hospital, a repasar todo lo que estamos haciendo, el plan de corrección que tenemos, que ya sometimos a ellos. Probablemente nos van a decir si lo aceptan próximamente. Y sí, cuando ocurren estos casos de que en un hospital hay un problema serio, ellos repasan todo lo que está pasando y tienen que estar seguros de que el hospital ha tomado las medidas necesarias para prevenirlo en el futuro. Así que ellos van a venir a checar y ver que todo está bien.
¿Es en estos días?
Probablemente en la próxima semana o dos.
Gracias.
Do you know if the 5 babies, were they all treated around the same time, or were they spread out, were their treatments spread out? What was the possible exposure to that?
It could have happened anywhere. We're estimating from September through August. The one that didn't have the BCG, that's the one we're probably going to concentrate on a little bit more due to the false positive nature. We're going to look at all of them at once, but that was a February exposure.
Is there somebody that can talk about the treatment that's being offered to these children, what the medication is and how it's being offered?
Well, the treatment that we're offering is called window prophylaxis, as we were mentioning. The medication that we're using is isoniazid. In short, they call it INH. And this medication is effective at treating latent tuberculosis. We're offering because we know that it's a safe medication. It has been used for a long period of time. And we know that in older people can see some side effects, but the younger they are, the less side effects that we can see on these medications. I understand that some parents are concerned with this medication. It has been a good medication that has been used for a long time, and it's still being used all over the country as recommended by the Centers for Disease Control.
Okay, if there are no other questions, thank you for your time once again, and we'll continue to keep you updated on a regular basis. Thank you.